my cat's been a little bit lethargic and they vomited a couple of times. Hearing that, it doesn't sound like the pet is that sick, but this is an example of a male cat that has a urethral obstruction. They can have had that happening for so long that they have a cardiac toxic level of potassium in their blood, and they quite literally may only have minutes left. I do work in a field with an approximately 75% mortality rate. And I think that small little amount of hope, the fact that I have seen patients pull through, I love the moment when a sick pet sees their owner after a period of time. You can see their eyes light up. You get that little bit of a tail wag that you hadn't been getting before. Just like knowing that there's any bit of chance is worth fighting for.
And now I know every pet owner hopes that they never face an emergency, but knowing what to do when things go wrong can save a life. Today I'm joined by Jennifer Lyons, a veterinary technician specialist in emergency and critical care based in Utah. We're talking about the most common emergencies, the warning signs you should never ignore, and how to stay calm when every second counts. Welcome back to the Paws Effect Podcast. I'm your host, Dr. Cara. If you enjoyed this episode, make sure to subscribe to the Paws Effect Podcast and share it with other pet owners. It could help someone act fast when it matters the most. So, welcome, Jennifer, to the Paws Effect Podcast.
Thank you.
All the way in the US, 7 a.m. for you, 3 p.m. for us.
Yes, early.
Very, very early. We've got so much to talk about today, and I don't want to miss the opportunity for us to tackle this from various angles. But just to set the scene, give my audience an indication of what you do, and then let's talk a little bit about your journey, because that will obviously explain some of the intricacies of our discussion today.
Yeah, thank you. So I am a veterinary technician specialist in emergency and critical care. What that means is I became certified here in the US, and then I spent several extra years training to do emergency and critical care specifically. So I work primarily in the ER and the ICU with some of the sickest patients that the hospital sees.
And why this particular interest? Where did this stem from?
Yeah, it was actually kind of a accident that it happened. I joined a new clinic that was a specialty clinic in the radiology service. And right after I started, my doctor went on maternity leave. And so I found myself in that downtime wandering up to the ER and the ICU whenever there was something going on. And it was kind of in that time that I discovered that that might be my real passion. So I spent the next year or so kind of doing both, and then eventually just transitioned to the ER and ICU completely. I think I like that we see a lot of different types of patients. So there's a huge variety. No day is the same. And I think that that's, for one, really stimulating for me, but it's also really rewarding to kind of deal with these really sick patients and help them go home.
Absolutely. And I mean, like you're saying, you can never really anticipate what's going to come in. So you're just dealing with it, trying to get as much information, and then you're trying to serve the best interests of your patient.
Yes.
So in terms of experience, this is tell us about, tell us a bit about what a veterinary technician is and how you become qualified to do what you're doing in the US.
Yeah, so in the US, veterinary technicians kind of do anything hands-on with the patient. So what we cannot do is diagnose, prescribe, perform surgery, and prognose. So pretty much everything else is kind of on the table. It's controlled at a state level. So every state is a little bit different in what technicians are allowed to do. The state I live in, Utah, is pretty lenient. So outside of those four things, as long as there's a veterinarian overseeing you, you can do whatever the veterinarian is comfortable with. So here, most veterinary technicians are working hands-on with the patient. So we're doing vitals, we're helping prep them for surgery, we're actually running the anesthesia. In the ER and the ICU, we're performing all procedures, doing x-rays, blood work, and then we're the ones that are actually hands-on with the patient, minute to minute, day to day. The veterinarian will do their exams in the morning, and then they'll decide the treatment plan, and then we're the ones executing it. So here, that usually requires 2 years of schooling. There is some on-the-job training options at different state levels. And then you have to pass the national exam.
And is that a practical or is that a written exam? How does that look?
It's a written exam that everybody takes. It is nationwide, so it's the same. It is not varied by state.
And from the time that you've been working in this field, has there been more and more interest in the capabilities of technicians and what you can offer from a team perspective?
Yeah, there's been a pretty big push to utilize technicians more. Historically, technicians kind of have been thought of as just doing restraint, like holding for the doctor. And that doesn't give very good job satisfaction to the technicians. So there's been a really high rate of turnover. So now there's a big push to educate technicians more, utilize technicians more to make this a true career path that people stay in for a long time.
Absolutely. And I mean, it makes complete sense, obviously, within the legalities of what we're doing to use people at the top of their expertise.
Mm-hmm. And also it's beneficial to the patients and to the doctors because they're able to see more patients, more clients by utilizing technicians appropriately, not expecting them to do absolutely everything. So I think it takes some of the workload off them. And here, at least, there's a huge veterinarian shortage. So having technicians that are more capable, more able to help in seeing more patients is better for everybody.
Absolutely. And I mean, I know we'll probably go into this a little bit further, but you have your own YouTube channel where you show some of the procedures that you do. I mean, these are very technical and very competent procedures that I think typically, even me being based in South Africa, we do not utilize our technicians to do these roles. Possibly there's a legal aspect to it or a liability aspect. What is the perception there in the US?
Yeah, so that legal aspect is still there. The veterinarians are essentially the one whose license is backing up all of these procedures. So because of that, I think it really just comes down to trust. The doctors that I worked with for years. They helped me learn these procedures. We have excellent communication, and I think that we both keep that communication open. So they know when I'm doing procedures, we've discussed the plan, we've discussed what we're going to do if something doesn't go well, and they're always nearby and I can grab them if there's a problem. So I think that building that trust and working on learning those procedures together is what has really gotten me to where I am. But yeah, I am doing more technical procedures than I think a lot of technicians have done in the past. So I'm placing central lines, I'm placing chest tubes. I can put a patient on the mechanical ventilator. But I always have the support of my doctor. They're always there.
Absolutely. And I mean, it's great that, like you say, the trust in the team, but the capabilities and you say job satisfaction. What is it that you particularly like about learning these things and also then sharing the information on your YouTube channel? You're actually, for new grads, this is very technical stuff. These are the kind of things that anybody in the profession needs to get to grips with.
Yeah, that's true. And I actually didn't know that it was going to be so helpful to veterinarians when I first started making it. So that's really exciting. I started making it because when I was going through the process of getting my VTS, I just noticed that there was no good information that was geared towards the veterinary field. I found myself studying a lot of human medicine and looking at supplemental materials from them because the material just wasn't there for veterinary technicians. And I just thought that was really disappointing. And I think that there's a lot of technicians that want to do better, want to learn more, want to grow and make this a career. And I think they find it really difficult because they can't access the material, especially with the wages that they're making. So it's kind of why I decided to start making it, is I really wanted to give everybody the ability to learn if they want to learn. And from my experience, most people want to learn, want to do better. And so I think the goal was to make it more advanced as time went on. But there's just been such a outpouring of feedback for a greater understanding of kind of more basic things that I think are often overlooked, like how to do fluid therapy and how to read an ECG. And these are things that, in my opinion, that in my opinion are life-saving, like being able to recognize arrhythmias and alert your doctor that there's something going on, that can quite genuinely save a patient's life. So I started making it because I want people to not only see what technicians can do and feel motivated to learn more, do more, and do it well, but I want to help people save more lives by being more educated.
I think it's phenomenal. And I think very much there are people who need to learn by visualizing those things. You can read what you want in a textbook and it may give you a series of images, but to actually see it demonstrated or to have someone explain it in lay terms can make a big difference in terms of your confidence to then go ahead and do those sort of procedures. So
yeah, I agree.
Very well done. I
Nothing ever looks like the textbook.
Never. So the majority of my listeners obviously are pet owners, and we are going to tackle some emergency discussion. Let's start off with what are some of the main, let's say the top 3 emergencies that you'd want every pet owner to recognize immediately?
Oh, that's a great question. So in my opinion, those are going to be things that are life-saving if you get them in quickly. So collapse can be from hundreds of different things. But if your pet is lethargic, not eating, not wanting to get up, that's not the kind of thing to monitor. It's the kind of thing to get your patient in really quickly. I think that in cats, one of the big things we see is urinary obstruction. And despite most people owning male cats, they have never heard of it before. So being able to keep an eye on your cat's urinary output, know that they're urinating like normal, and know if they're not, that's also something that can be life-saving if you recognize it quickly, because they can die from that. And then small changes, in critical care, we believe small changes make big differences. So just noticing small deviations from normal. If your pet is normally a big runner, loves to go outside and run around in the backyard, and then all of a sudden they're not doing that as much, or they're coughing when they do it, or they're developing some kind of exercise intolerance, those things aren't always age. And I think a lot of people assume like, oh, my pet's older, they're just starting to slow down. Well, we believe firmly that age is not a disease. There's something that's making them that way. So if your pet is slowing down, maybe don't assume that it's arthritis or something like that. Get them checked out. It could be treatable heart disease. It could be an early sign of cancer. And a lot of these things are more treatable if they're caught early.
Very much so.
You look at me, I look at you, I see the love in your eyes.
Health you can see, love you can feel. UltraPet, the science of love.
Some of the questions that we get, particularly not necessarily that we hear, but owners phoning in saying, I don't know if this is an emergency or whether it can wait for the morning. What is the kind of, you've mentioned some of them like collapse, but how do you have this conversation with owners to determine whether this is something that can wait and be seen in normal hours? And obviously from a financial perspective, there's often the desire to do that, or things that just need to be seen immediately without delay.
Yeah. So things that are probably okay to wait until the morning, small changes like, oh, my pet was vomiting a little bit, but they're still pretty bright alert. If your pet is considered bright alert, they're still walking around, running around, interacting with you, seem relatively happy, they're probably okay to wait. One episode of diarrhea, probably okay to wait. But if your pet has a huge deviation from normal, they're vomiting, they won't get off the floor, they have breathing changes, these are things that probably can't wait. So in general, I just kind of go based on attitude. If your pet still seems pretty happy and interactive with you, you're probably okay to wait until the morning. If they're really lethargic, that's not normal for them. They don't want to interact with you. They seem a little dull or depressed. Those are probably things that can't wait.
And from experience that we never, feel that it's too early to seek assistance, even if it's a case of no, everything's fine. You'd rather that than things progress and they can change quite quickly. So
absolutely,
I'm in agreement that minor things are fine, but we always from a professional perspective, struggle to say, oh, no, it's fine to wait, unless it is just, one off vomit or a little bit of diarrhea. So I'm in total agreement. And you mentioned an interest in anaesthesia and critical care. What's something that owners don't often realize about how risky anaesthetics can be for sick pets, and how you can go about making things safer for them?
Yeah. So anesthesia, unfortunately, is never benign. Even in a healthy patient, they can have complications. I was just treating last week a patient who was totally healthy and had an event under anesthesia. We still don't know why. He was only 5 years old. The drug protocol was totally safe. So unfortunately, pets can have underlying disease that we don't know about. We can't detect no matter how much pre-anesthetic workup we do. So it's just important to recognize that despite your veterinarian's best efforts and despite completely adequate monitoring, safe protocols, complications can happen that we don't anticipate. And in my opinion, what makes a good veterinarian is how they react to those things. Are they able to quickly reverse the medications they gave? Are they able to perform CPR? Are they able to do life-saving measures if that's something you want? And those are great questions to ask your veterinarian before they undergo a procedure. And then pre-anesthetic diagnostics are not something to skimp on. Unfortunately, I think a lot of people are like, oh, like my pet is young. Like, why do we need to do blood work? Because all of this stuff costs money and comes out of our pockets. So it's totally understandable to want to be able to save some money. But pre-anesthetic diagnostics can be life-saving. There can be things wrong with your pets, even when they're little, that you don't catch, that we can catch sometimes on pre-anesthetic blood work. I've definitely seen a healthy young dog come in for a spay, get blood work done, and we find out that pet is severely azotemic from a congenital kidney disease that they didn't know their pet had. So these are the kind of things that can make a big difference and make anesthesia safer by making sure we're doing those appropriate pre-anesthetic diagnostics. And then from the veterinarian side, we can do safe anesthetic protocols. And I think it's totally fair for an owner to ask, like, is your team experienced doing this procedure? Is your team experienced doing anesthesia? Who's going to be monitoring my patient while they're anesthetized? Because it can really make a difference knowing that your pet is being anesthetized by somebody who has a lot of experience monitoring them and knows how to catch small differences, how to change the anesthetic plan based on how the patient is doing.
And how important is a history in terms of also mitigating some of this risk?
It's incredibly important. I worked with a doctor that thought that they could completely diagnose a patient based on history and physical exam because those two things can make such a big difference for our patients. So like a healthy pet that has small changes like, oh, they've been drinking more water at home, or they've been eating, but maybe slightly less than normal. Those things can make a huge difference for anesthesia. Like a patient that is drinking more could have kidney disease. A patient that, again, has that slight cough, maybe they have early heart disease that we haven't caught on x-rays yet. So being very open and honest with whoever's taking your history, I agree, can make a huge difference. And, an accurate, in-depth physical exam also by, a trained professional makes a huge difference undergoing anesthesia. Even myself, I like to do nursing exams on my patients before I anesthetize them. I like to know, does their heart look underloaded? Do they look like they have adequate volume? If I have any problems with hypotension under anesthesia, is the answer going to be fluids or is the answer going to be something else? So making sure the entire team is familiar with the patient and doing their pre-anesthetic exams also really matters.
So true. Very true. I mean, I think, and things change again, so having that information at hand, you're dealing with things at the time, but also someone with the experience, like you say, to be able to manage things as they progress, which is very typical in emergency medicine. In terms of an emergency, owners are on their way to the ER. What are some of the things that they can do that can support their pet? And what is sort of the worst thing you've seen done in terms of, with great intention, but on the way to the ER that has actually had a negative impact on their pets?
I'll start with the first one because something immediately comes to mind. A lot of people want to give their pets a bath before they come in. I think just because they want their pet to be clean when they come to the ER, they've been vomiting or having diarrhea or something like that. That's a huge no, because usually those pets are really cold when they get to us, and the cold contributes to the degree of shock that their body is undergoing. So don't bathe your pets. We're okay with seeing them at their worst, and we can deal with cleaning them when they're a little bit more stable. The other thing is please don't give your pets hydrogen peroxide. I think that is kind of an outdated recommendation that like, oh, I can save a trip to the vet by giving them hydrogen peroxide to help them vomit because I think they ate something or I'm worried there's something in their stomach. I unfortunately have seen a pet die and pass away from hydrogen peroxide poisoning. It's very toxic to the esophagus. It can cause esophageal damage, ulcerations, GI ulcerations. I know that we used to do it, but I'd say the only scenario in which I would say that's okay to do is if you are 4 or 5 hours from a veterinarian and you know for a fact your pet ate a toxic dose of a medication. You saw them eat the bottle of ibuprofen. Then that's maybe you can try a little bit. But don't do it just because you like think maybe your pet ate something. Trust me, save your money and go to the vet.
Yeah, no, we've had the salt water and the washing powder, and obviously hydrogen peroxide. Those are big no-nos. Rather than do that, go and consult your vet and let them have safe measures, particularly with the risk of aspiration. And my brain goes into the possible consequences of it too. Terrible. Yeah. Take us through some of the things that we ought to do.
Yes. So that's kind of a hard question for me because I just feel like there's so little that I feel like people can do. Some things that come to mind, if you're bringing your pet to the emergency because they've collapsed, you can initiate CPR. If your pet there's 2 things we want you to look for. Is your pet breathing? And is your pet responsive? So to evaluate if your pet is breathing, you can look at their chest, look at their abdomen, and see if you see movement. And then to evaluate if they're responsive, there's 2 really fast things you can do. You can try to open their bottom jaw and see if they have jaw tone. If their jaw is completely slack and opens easily, I would call that non-responsive. Something else you can do is tap the corner of their eye. That's called a palpebral reflex. If you tap the corner of their eye and they don't blink, that's an absent reflex. So those things together tell me your pet is apneic, meaning they're not breathing and they're non-responsive. And those are the 2 indications to start CPR. If your pet has passed away from something treatable, starting CPR en route can be life-saving. There's a lot of literature in human medicine that shows the duration of CPR doesn't necessarily affect outcome as long as CPR is done well. So if you think your pet is not breathing and not responsive, you can start breathing for them. And so this sounds a little awkward to people, but you can do ventilation for them by mouth to snout ventilation, meaning you're closing their mouth and then you're putting your mouth or your hand over their nose and you give them 2 breaths through their nose. After that, you do chest compressions. You count to 30 in your head and you're aiming for a beat of about 100 compressions per minute. So you do 30 compressions, you stop and you do 2 breaths. And if you have the ability to do that when you're en route to a veterinarian, I know that's not always possible if you're alone, but starting CPR early can really improve outcome. Outside of a patient who needs CPR, if you happen to have any oxygen in your house and your pet is not breathing well, you can try to provide flow-by. Some people have those emergency oxygen canisters. They only have a few minutes of oxygen in them usually, but anything helps if your pet is having a hard time breathing.
Let's talk about the bleeding patient or the patient that has or I'm talking patient because I'm assuming they've got to us already, but the pet who has maybe fractured their leg or been hit by a car, when is it appropriate to try and support and stabilize those wounds, and when is it a big no-no and just a case of getting to your ER?
I see a lot of people try to apply tourniquets for minor bleeding. Tourniquets are meant for arterial bleeding only. And I know that from the lay perspective, it can be really hard to tell if your pet has an arterial bleed. But it's kind of going to just be based on volume. If your pet has a wound that is quite genuinely spurting blood out of it, there's a chance that could be arterial. But most, I would say 90 to 95% of wounds do not have an arterial component to them that need to be tourniqueted. In my 10 years in emergency and critical care, I have seen maybe a handful of patients come in with true arterial damage. So tourniquets don't have to be done right away. If you're, again, camping out in the woods and you're hours away from a veterinarian and you aren't sure if your pet is going to bleed to death, you can try to do a tourniquet, but they do have to be released. Otherwise, you're going to cause damage to everything else that is tourniqueted. So if that's something you think your pet needs or you're not quite sure, you can try it, but make sure you're releasing it. I would say at least every 15, 30 minutes. In people, they do 2 hours, but that recommendation scares me a little bit. You can place soft padded bandages if you have the ability. A big injury we see here, because we're a big ski town, is pets that have had the sides of their foot or their leg sliced from skis because they take their pets cross-country skiing. So that type of injury responds really well to being bandaged because it's on the foot or it's on the leg. It's easy to throw a quick wrap on there. But again, that can just be a nice light wrap to protect it from the elements as opposed to like trying to create tamponade and stop bleeding. And then if your pet has a broken leg, for the most part, if you're on your way to the veterinarian, you probably don't need to do anything for it. They can assess it when you get there. If, again, you're really far from a vet and you want to do something in the meantime, it kind of depends on where the fracture is. If there's a fracture of the distal limb, so that means below the elbow, below the knee, you can try to stabilize it. You could try to use a piece of cardboard or a stick to try to stabilize the top and bottom of the fracture. If it's above the elbow or the knee, it's better to just try to get your pet to lie down and encourage them to lie down. These pets are really anxious and worked up, so that doesn't always happen. But unfortunately, those types of fractures can actually be made worse if you attempt to stabilize them, because the point of stabilization is to stabilize the joint above and below. And so if you think about these higher up fractures, the joint above is the shoulder or the hip. And there's no good way of stabilizing that out in the field. So just try to get your pet to lie down, encourage them to be still, and that'll try to prevent them from being in more pain.
And when is it appropriate for owners to raid their medicine cabinet to give human medication? And what is a big no-no?
Yeah, we see that a lot. I would say if it's a cat, there is nothing. Do not give them anything out of your medicine cabinet. There are so many things that we take that are very toxic to cats. Excedrin, and I guess I don't know if the brand names are different, but anything that has an anti-inflammatory in it essentially is probably going to be very toxic to your cat. And some of those medications are very difficult to treat. So for cats, don't give them anything. I know it's really sad, but they're pretty sturdy little creatures, and they can usually be in a little bit of pain until they get to the vet. As far as dogs, there are some things that you can give that I feel pretty comfortable saying. People that might have prescription trazodone or gabapentin, those things are safe for dogs, and pretty much at the same dosages that people take. Again, I don't think that there's a lot of benefit to it, just because if you're on the way to the vet, it's really better to just let them give it, make sure they're getting the dosages correctly. There's, again, a lot of toxic things for dogs too. So pretty much all human anti-inflammatories, with the exception of some aspirin and acetaminophen. But those doses are different than what people take. So those things, it's really just best to let your vet give them. Again, they're sturdy. It's really sad to see them in pain, but it's much better than causing kidney injury or any kind of other potentially life-ending problem.
And how important is it, or do you advise within your practice, I know it's not necessarily applicable in all practices, for owners to call ahead of time to say, I'm on my way, this is my situation, please can you let the team know?
Always. I'd say if you are on the way to the vet and you think that there's something potentially really wrong with your pet, always call and let them know. They can advise you over the phone on if there is anything that you can do. They can get their team ready. If their pet's just vomiting, having some diarrhea, you probably don't need to be like, we're on our way. But if your pet's having a hard time breathing, if they've collapsed, especially if you're going to a vet who isn't a specific emergency veterinarian, the veterinarian's not always there. The team may be a really small team. They could be closing or going on lunch. So calling ahead, making sure like, hey, can I come in? Is there somebody to see me? Because usually they can say like, no, there's nobody here right now. Please go to this ER. They can help you find a better place to go if you need to.
Great advice, and I totally agree. I think that phone call is so important. I know a lot of people are discouraged. They feel like they're wasting time, their time or the vet's time. But I think it's nice to be able to, get the crash kit out, set things up, free up the team, put away that patient that doesn't need your urgent care.
Absolutely.
And get ready to deal with things. But also even psychologically for us as professionals to kind of anticipate that that's coming in, it helps. So let's go down that route. We often have situations where there are multiple pets that will come into the ER. So I'm talking after hours type care. Let's talk triage, what that means, and why owners need to be aware that they need to trust the professionals in terms of prioritizing who is seen first.
Yeah, that's a great question because I think that's something we say to people and they don't really understand what that means. So when you go into your vet or your emergency vet, they're going to want to look at your pet because they don't know if your pet is stable. And so what that means is they need to decide if your pet has an illness or injury that needs to be treated urgently to provide life-saving measures. And we don't know that until we look at your pet. And a great example is a really common presentation for a male cat is like, oh, my cat's been a little bit lethargic and they vomited a couple of times. Hearing that, it doesn't sound like the pet is that sick, but this is an example of a male cat that has a urethral obstruction. They can have had that happening for so long that they have a cardiac toxic level of potassium in their blood. And they quite literally may only have minutes left, even though from the owner's perspective, like, oh, they're up and they're walking around, so they can't be that sick. But that small amount of time can really push them over the edge. So that's why it's so important for us to actually look at your pet, because we can listen to their heart and say like, oh, their heart is really slow. That's abnormal. We can feel their bladder and say, I think they have a urethral obstruction and we need to initiate life-saving measures right now. So it's really scary because especially if you're going to a vet you haven't been to before, you don't know anybody, you don't know what's happening in the back, in the treatment area, but being able to get vitals, being able to have the veterinarian look at your pet quickly. Because I think a lot of people don't realize is that when we're taking your pet back, usually the vet is looking at it. We're getting vitals, but even if the veterinarian doesn't do a full exam yet, or even if they don't have time to talk to the owner, they put their eyes on the pet, they may listen, they'll walk over and do a small exam to determine if they think the pet is stable. So just being able to have that hands-on time with your pet helps us to find small things that you may not know is going on. And especially in a busy ER, these technicians are really trained to be able to triage and recognize small problems in your pets. I can't tell you the number of times I've seen a pet come in and the owner goes like, oh, I don't know, she's just been coughing a little bit. And then we bring them back and they're cyanotic and in heart failure, and we're able to give them oxygen and start giving them medications before the vet even comes and talks to you. So it's definitely scary to let your pet sit in the back of people that you don't know and that they don't know, but it can quite genuinely be life-saving, even though it's scary not seeing where your pet went.
Absolutely. And in practices where there is a waiting room and people are concerned about how long it's taking to be seen by their vet, what are some of the things that they need to alert to say, look, this pet is now deteriorating, or whether you should alert your receptionist to be aware, or the people walking around to kind of recognize these are the kind of signs that mean that they need to be seen as a priority?
Yeah. So if you're going somewhere that doesn't triage every patient on arrival, or it's a holiday and they're incredibly busy, unfortunately, we end up triaging based on presenting complaint. So if the presenting complaint is just vomiting, the stable vomiting patient is probably going to be one of the last to be triaged if everything else is sounding a little bit more critical. But an example, a lot of pets come in for vomiting and they actually end up having a GDV, which a lot of people know as bloat. And that is a life-threatening emergency that has to be seen right away. So if you are thinking that your pet is more critical and hasn't been triaged yet, maybe just go and have a conversation with the receptionist and say, hey, I know I said just vomiting, but my pet is having difficulty breathing. They're duller than they were. They're laying down. I can't get them up. Just kind of going over more problems rather than just one simple initial concern can really trigger them to say, like, okay, I'm going to send a nurse out to you right now.
Yeah, that's really great advice, and so true. You know, the typical, we're very alert when we hear that unproductive vomiting or the abdominal distension. Those are red flags for us. But for pet owners, often they don't, or they see them at a point where they're not showing dramatic signs. It can be a very critical time in terms of life-saving or unfortunately losing them. So important that owners are also aware of some of the things that they need to flag.
Yeah, and I know that people may feel like bothersome, like, oh, I already talked to the receptionist, I don't want to bother them again. But we understand that things change. Again, those minute-to-minute changes, they happen. And so we're totally okay, even if your pet's been triaged, re-triaging them just to make sure everything is okay.
So we started at the start of our conversation talking about the role of a veterinary technician. These are some of the things that I think from a team perspective can really help in terms of burnout, and also, like you said, the enjoyment of your job and like longevity of the profession. What do you see in place where you are not utilizing your team to its full capacity? What are the consequences of that? And let's just talk about the impact of a good team and utilizing people to the top level of their capabilities.
Yeah. From the perspective of leadership, if you're not appropriately using your team, they're going to be really unhappy at work. Burnout is going to become a much, much bigger problem that happens quicker. You are actually going to lose production. Your team is not going to be efficient because they're unhappy. They're not being utilized correctly. You're going to see less patients. Unfortunately, the reality of it is that there are going to be medical mistakes because people are not as fulfilled. They're not as educated. They're not as invested in this as being a career. And so medical mistakes are going to happen. And your doctors are going to get more burnout. You're going to have a huge problem with increased turnover. You're not going to be able to keep people for extended periods of time. We know from studying this that high turnover costs more money. Training people takes a long time, and reinvesting in your team is eventually cheaper than to be continuously training new people. So, and ultimately, you're going to have better patient care if you're appropriately utilizing your staff. And better patient care means better outcomes. It means happier clients. It means more lives saved. And this is a total legal aspect, but it also means less legal problems, less need to have lawyers involved because there's less mistakes because the team is invested. And I think that motivating your team, making them want to be there, making them care about the medicine, those are things that are going to be life-saving for patients and that are going to make clients, veterinarians happier, less burnout, less turnover.
So what are some of the things that veterinary technicians, what can they do legally, and how do you go about training them practically if you want to utilize them within your team?
Yeah. And I think it's going to be hard because I don't know how many of the laws are different. What are technicians allowed to do there?
So we have quite good legal specifications as to they can do this, they can't do that. So it's quite clearly sort of set out in terms of, a bit like our council provide us with. I don't think they probably have as much I'm trying to think now. They can vaccinate and they can put IVF, very much stuff that you mentioned under veterinary supervision. I think the issue comes in with medicating away from practices. But in terms of capabilities, this is something that we are developing within our practice in terms of utilizing animal health technicians. But I don't think necessarily they've got the legal freedom that you do under your guidelines. But I'm hoping that will change because we're seeing the pressures of practices being understaffed, and the burnout from vets, nurses and down, and then the desire to be able to do a job that is fulfilling and they are perfectly capable of doing. So I think, we talk generally in terms of the guidelines that you've got and what you can do, but I think it may change over time in terms of recognizing that this is going to be a tool to providing better patient care.
Yeah, definitely. Okay. So the way I approach training new staff is I really want to make sure they have the basics down. So any of the foundational skills that I think are prerequisites to performing a more advanced skill, I want to make sure they're excellent at those. So I will quite genuinely hold mini CEs in my clinic where I'm going over those basics. And I do end up quizzing the team and I make it fun and exciting for them. But making sure they have foundational skills is the first step. And then having somebody training them that is very competent in those skills and that enjoys training. Not everybody who's excellent at their job likes training or is even good at it. So don't force somebody to train that doesn't want to. The result is not going to be good. Find those people who are really passionate about it and who do it well and let them do it. So it doesn't need to be the same person for every skill. I'm exceptionally passionate about appropriate NG tube placement. So I'm a great person to teach NG tubes. But there's a lot of skills that there's probably people out there that are better than me at them, and they should be teaching those. So trying to let people find their niche and do the trainings that they would excel at. That also helps to involve more members of the team. Maybe you've got a doctor out there who loves anesthesia and wants to help people be better at it. Let them do little mini anesthesia trainings. And again, starting with the basics, starting with those foundational skills, especially for something as advanced as the anesthesia, because those foundational skills play such a big part.
And in the kind of misconceptions that owners have about what you can do and what you can't, I mean, do you have any resistance from pet owners themselves?
It's so interesting. No, never. I feel like the doctors that I work with are excellent at letting people know, this is Jennifer. She is your pet's technician. She is monitoring them. She is with them all the time. And a lot of the clients I end up working with, because I work with these really sick patients that are in the hospital for a long time, they end up knowing me. They're like, oh, can I speak with Jennifer? Because she's my pet's nurse. They know that I'm the one that's doing their pet's anesthesia, that is placing their pet central lines. And we end up forming a really big bond. I'm actually really close with some of the owners that I've worked with for their pets that have been really critical and that have pulled through. And we have a really close relationship. So I think people like it. I think they like knowing who's involved in their pet's care. It takes the mystery away. It takes the stress away, especially when they can like see the way that you interact with their pets. People come, I'm a big advocate for people coming into the treatment area. And so is a lot of the doctors I work with. So we'll have a lot of owners in the back, and they can see what we're doing. They can see how we're interacting with their pets. And I think it makes them feel better. I actually think it makes their pets feel better too. They see their family with the person taking care of them. It helps to kind of strengthen that bond. I've had a lot of pets that were a little bit fractious or aggressive that became much easier to handle once we were able to kind of strengthen that bond with their family. So don't be afraid to ask, like, are there visiting hours? Can I see where my pet is staying? Can I meet the team that's taking care of my pet? It's really going to help with that trust.
This building trust is so important. Now, you work in cases where the prognosis can be poor and often is. What keeps you motivated in those moments?
Oh, unfortunately, I think I'm a little bit of an eternal optimist. I do work in a field with an approximately 75% mortality rate, meaning we unfortunately lose or euthanize a lot of our patients, but not all of them. And I think that small little amount of hope, the fact that I have seen patients pull through unbelievable odds, I think that's one thing that keeps me going. I'm kind of a sucker for, I love the moment when a sick pet sees their owner after a period of time. You can just see the small changes in them. You can see their eyes light up. You get like that little bit of a tail wag that you hadn't been getting before. And just like knowing that there's any bit of chance is worth fighting for. And I think families feel that way. You know, they want to give their pets every chance that they can. And so do I.
And on a slightly lighter note, what is the most bizarre emergency case that you've seen walk through the ER doors?
Oh, man. There's probably quite a few. One of the first things that comes to mind is we had a patient coming in that was actually a transfer from a primary vet, but we had no idea they were coming in. They were a referral from a vet kind of way out in the middle of nowhere. And so the pet comes in wearing an e-collar and has an endotracheal tube sticking out of the side of its neck. And so for those listening that don't know what that is, that's the tube that they get intubated with for anesthesia. This dog had presented to the vet the night before. They weren't able to breathe. The vet did an oral exam and couldn't get them intubated. They were starting to arrest. So they did an emergency tracheostomy, which is where they placed a hole in the trachea in the side of the neck and put an endotracheal tube in there and sent the pet home. And the pet came in the next morning. And I am literally like, to this day, all hands down to this vet. She saved that dog's life. It was incredible. And he just looked like he came in with a little snorkel. He was breathing totally fine. He did not even care that he had this tube in his neck. We were all shocked. But it's an incredible story because then we were able to get that dog to the surgeon. He did have a mass in the back of his throat. We were able to debulk it. And he went home that day. It was incredible.
I can imagine.
Outside of that, I've seen a lot of crazy stuff. A lot of it's probably not like super exciting to hear about. But my clinic is the clinic that sees all the local police canine officers. So we have had some patients come in with gunshot wounds that we've been able to treat. We also were really close to the outdoors. So we see kind of a lot of like crazy outdoor injuries. And a lot of these traumatic injuries, pets actually surprisingly do pretty well with.
Yeah, I'm going to take a moment because you shared your cat. She's come into the studio.
Oh, how cute. Oh, she's so pretty. Is she a Bengal?
Yes, she is.
Yeah, she's beautiful.
She either chooses to sit on my lap or not. And at the moment, she's sniffing around. She doesn't have any interest in me, which is very typical cat.
That is very typical cat.
And in terms, sorry, I digress. And in terms of, can you give me an example of when there were all hands on deck and the importance of having a technician, you, and people like you around so that you can, as a team, achieve a positive outcome for a patient?
Yeah. I think that having technicians that are really, really good at basic skills is life-saving. I think we're really lucky in my clinic in that there's myself and several other technicians who are incredible at placing IV catheters. And that is so basic and it sounds so silly, but getting IV access, especially in an emergency situation where you can give medications, is quite genuinely life-saving. A lot of practices have to do things like intraosseous catheters where they place a catheter into the bone. We literally never do them because our technicians are really, really, really good at placing IV catheters, which is great because it's less traumatic for the patients. It's more comfortable. It's faster access. So having people that are exceptionally good at these basic skills, life-saving. An example where there's all hands on deck is obviously going to be a patient that comes in having coded in cardiopulmonary arrest. But these are moments that you need one person per task if possible. So having somebody intubating, having somebody starting chest compressions, having somebody placing a catheter, somebody drawing up drugs, somebody getting monitoring on the PET. These are the moments when there's literally 8-10 people in our clinic around helping your pet. And all of those people play a role and getting that care on board really quickly in those minutes where every single minute makes a really big difference. Like life-saving.
And tell me, just obviously we're running out of time, but I don't want to lose the opportunity. Tell me, how do you decide what you do in those sort of situations? Explain to pet owners if their pet comes in and they are collapsed and they are needing a big team, how do you decide who assigns the tasks?
In general, it's either the person that's the closest or the person with the most experience. And there's kind of, depending on the situation, there's an order. So if your patient comes in arrested, there's a specific order in which has been studied to be the best order, and that's the order that will do something. So in those situations where there's multiple people that are able to help with CPR, the order is that one person is doing chest compressions and it's the first person who is touching the patient. The second person on site is intubating your pet and then is going to provide ventilation for them. And the third person is getting IV access. And the fourth person is getting IV drugs pulled up. The fifth person is getting monitoring on board. And so that in my clinic works really well because we all know, we all train on it. Unfortunately, we all do it almost every day. We have a very good flow. But also the veterinarians are there, they're around. And if they see something that needs to be done that's not being done, they know how to say, I need somebody doing this. And everybody knows if they have the ability to do that, they're saying, I'm doing it. So excellent communication also in those situations. And then as far as like outside of CPR, knowing what to do is just a matter of experience in triage. You know that if a patient is coming in for respiratory distress, they need oxygen. You know that if a patient comes in with difficult breathing and retching and a bloated abdomen, they need to be assessed for a GDV. They need catheters and fluids and trocherization. So a lot of that comes from experience. So having a technician and a doctor who are really experienced at those things, who can walk on board and say, this is what needs to happen, can make a big difference. I remember specifically, we had a patient one time who they thought it was a bloat or a GDV because it was a Great Dane. He was here for like drooling, dry heaving, had all the signs of, oh, this dog probably has bloat. They did the abdominal rads and it didn't look like it. And the dog was going into respiratory distress. So they got him out. I walked in, that dog was blue. He was bradycardic. He had a restrictive breathing pattern. He had all the signs, in my opinion, of a dog who had a pneumothorax. And so I quickly looked at the rads and I was like, we caught part of the chest. This dog definitely has a spontaneous pneumo. We were able to tap that dog's chest as he was starting to arrest. And by doing that, we were able to prevent him from arresting. We placed a chest tube and he was able to go surgery and he ended up doing fine. So having people that are experienced, that are trained, that you've invested in, that can walk in, communicate with the team and get things done efficiently is really important.
And I know I'm being waved at by my producer here, but I've got two more questions for you before I'm prepared to go. I want to understand why and how you determine whether this is something that you should be doing career-wise and you just need more experience and support potentially, or emergency medicine and critical care is just not the field for you. And from a personality perspective, it's worth pursuing a different area of vet.
Yeah, that's a great
question. Can you help me with that?
Yeah. As far as specifically emergency and critical care, it's just really important to recognize that you got to find the department that fits your personality. I've got a technician who works part-time with me, full-time at a different clinic, and she's amazing. She does everything well. I love her. She loves dermatology and she's excellent at it and she knows everything about it. And so you can fit into multiple different departments, but you got to do what your heart says that it loves. As far as longevity, I agree. Emergency critical care is not the department for everybody long term. I also work with another technician who, again, amazing at everything. I love her. She's the most empathetic person I have ever met in my entire life, and she cries 3 times a day. And so maybe emergency and critical care is not quite the right fit for her, although she loves it because it's really hard on her. And she ends up sad a lot. So you do unfortunately need to be able to have coping mechanisms in place. You need to actually internally evaluate, is this something that I can handle? Does my personality fit with the amount of sadness that we see? Am I able to separate it a little bit so that I can do my job? I've also worked with somebody who was so empathetic towards the patients that she couldn't do the treatments. She couldn't bring herself to place a catheter because it might hurt the pet. And those personalities are totally fine because there are the right fields for them still. So it's definitely good to evaluate, am I going to be able to handle the sad things that I'm seeing? Because I'm going to see a lot of them. Am I going to be able to put my head in the game and do the things that need to be done, despite the fact that it may be hard for the patient in the short term? And if the answer to some of those questions are no, there are other departments that you can still get great connection with the patients, great fulfillment, but maybe don't have that deep emotional bond that does happen in the ICU.
I totally agree with you. It's a very high pressured and high stress position, and some people thrive and others just don't, and that's also okay. So my final parting question, we have had cases where owners have had their pets experience potentially some traumatic incident, whether it be snake bite, hit by car. I'm giving some examples for the listeners to get some context. And then in the event of trying to help them, have been injured themselves. How do you advise owners protect themselves when they're trying to help their pets, particularly when they need to come into the ER?
Yeah. Unfortunately, I think that's really common. I see owners that come in that were bit all the time because their pet was painful. They had to pick them up to put them in the car. So trying to listen to your pet. If your pet is screamingly painful, you do need to protect yourself. I've had owners that have had to immediately go to the ER themselves. So try to stay away from their head and mouth. As hard as it is, if you have something you can throw over their face so that you can be a little bit shielded from their teeth before you do something you know is going to hurt, like pick them up after they've been hit by a car. It's important that you're still able to get your pet to the hospital and that you're okay. So even though those are really scary moments, try to stay away from the bitey end. If your pet is having a seizure, I think a lot of people try to open their mouths because they're worried they can't breathe. they can breathe. Don't stick your hands in their mouth. They don't know what they're doing. They don't have control over their muscles. So just do everything you can to recognize that your pet is not themselves in those moments. Their basic instincts are kicking in that if something hurts, they're going to bite to tell you to stop, even pets that have never bit before. So just try to stay away from their head and mouth, listen to them, go slower if you need to. If your pet is in that kind of condition and they're biting you, you probably have a couple of minutes to try to find a towel, to try to pick them up before you get them in the car.
That is great advice, because I totally agree. I think it's awful when they come in and they generally prioritize their pets, but then they are also facing the ER and antibiotics and anti-inflammatories, and it's horrible. So that's really good advice. This has been a really great conversation. I'm so grateful for your time and your expertise, and you've explained things so beautifully. So I'm really, really pleased that we got the opportunity to chat. But if people want to find more information from you, they want to contact you, they want to watch some of your videos, where do they find you? What social media platform are you on, and what are your handles?
Yeah, so I'm on YouTube, Jennifer Lyons, which is Lyons BTS. And my Instagram is the same. On my YouTube, I post like more educational videos. On my Instagram, I post interesting cases or kind of like fun things that I see in the ER and the ICU.
That's great. I urge the listeners to go and take a look. Both of your pages, like you say, are very different, but both equally inspiring and not gory. It does warn you, doesn't it? In terms of some of the things for sensitive viewers. But no, it's brilliant. Some of the videos are exceptional, and I would urge even vet professionals and nurses, particularly if you're starting out, to go and check out the YouTube channels. Really, some really great stuff on there. Thank you, Jennifer, for taking time out of your day very early in the morning.
Thank you for having me. This has been great.
It's been such a pleasure. Thank you so much for tuning into today's episode on the Paws Effect Podcast. If you found the discussion helpful, please like, share, and follow our podcast. Don't forget to leave us a comment or review. We love hearing from our listeners. Remember, you can listen to us on your preferred podcast platform. Welcome back to Just for Pets. You're with Dr. Cara.
Hi, Doc. It's Jackson the Jack Rossi here, and boy am I itchy.
Are you on a hypoallergenic diet?
Hyper what now?
Changing to a special diet will really help. And Just for Pets have a massive range. And flea and tick medication, special shampoo.
Ooh, how quick can you get some?
Order today and we'll deliver pronto.
I feel better already.
Justforpets.co.za. Vet approved, pet adored. Get it all to your door.